everybody, I'm Dr. Nick Circolone. I am so excited to be here today. Today we're going to be talking about symptoms that are caused from cervical spine issues, specifically about the shoulder and how the cervical spine affects shoulders and causes shoulder pain symptomatology. But first, don't forget to subscribe. Hit that notification button to get the videos as they come out. If you have any questions, please do not hesitate to leave them in the comments. If you have any questions that are related to the subject or that are not related to the subject and you would like to know more about, please leave those comments in the comment section. So let's get started. We're going to be talking about how the shoulder is related to the cervical spine. So let's go back to the anatomy that we talked about before. We have 7 cervical vertebrae. From that area, we have the foramen, which we talked about earlier. And in that foramen, we have a nerve. Those nerves come out of that foramen. They come together and they create what's known as the brachial plexus. Now, if there's any injury to the brachial plexus, we have a myriad of problems. But today, we're just going to discuss how the nerves of the cervical spine can affect the shoulder, because, number one, the nerves that innervate the muscles of the shoulder can actually be working improperly because the message from the brain to the muscle is not getting there because of nerve impingement or compression of a nerve or nerve irritation, which will cause someone to be more prone to injury of the shoulder. Now, does every injury to the shoulder mean that it's coming from the spine? Absolutely not. We can have injury of the shoulder from accidents, overuse. There's a lot of reasons why we can have shoulder problem, and it's not related to the neck. Let's think about this. If the message from the brain is not getting to the muscles of the shoulder, could there be an injury that can occur that's related to the weakness of the muscle due to the cervical compression, irritation, inflammation of those nerves? Let's think about that. Personally, I've seen a lot of shoulder injuries, and what came first, the chicken or the egg? A lot of time it's a cervical issue that's related to weakness of the muscle because the nerves are being interfered with. Let's look at who works on repairing shoulders. It's usually your orthopedic surgeon. So if you don't know, I'm a board certified chiropractic orthopedist, which means I'm certified in orthopedics in non-surgical form. So I deal with the doctors that deal with the surgeries. A lot of times what they'll do is they'll see that there's an injury to the shoulder and they repair the shoulder. That's what their job is. That's what they do. They're supposed to do that. And those are the guys that you want to do that. You want them to fix your shoulder, the ones that do it all the time. But there are times when we repair the shoulder and we still have issues. Why? Because the problem wasn't necessarily the shoulder. The problem was the neck. And we see that a lot. Now, I'm not saying the doctors that do the surgery are doing surgeries that they're not supposed to be doing. I'm not telling you that. What I'm saying is if we see a tear, if we see an injury to the shoulder, we want to get it fixed, that's the first thing that they're going to take care of. It's not the neck that they're looking at. I look at the neck first. Let's see what the neck looks like. So if you have a shoulder problem and come into the office, we're not only examining the shoulder, but we're also examining the neck. If I believe that there's a cervical issue associated with the shoulder, not only am I going to get x-rays of your shoulder, but we're also going to get x-rays of the cervical spine, because the cervical spine can be implicated in injuries to the shoulder. If any of the nerves are slowed down for any reason, it's called exoplasmic flow. We measure that with EMGs. And what an EMG is, an electromyography, and what we're doing is we're checking from point A to point B to find out if there's any compression in any of the areas. And they're pretty specific. Also, we use MRIs to check the soft tissue to see if we have any rips or tears. Now, just a side note, if you have a shoulder problem and you're going to have an MRI, do not get an MRI without contrast. Unless you're allergic to the contrast, you get an MRI of the shoulder with contrast. The reason why we use contrast when we're doing a shoulder MRI is because we want to see flow around the joints and around the muscles. Because sometimes there's a tear in the muscle and we really can't see that well unless we have a contrast in there showing us exactly where that is. So that's just a sidebar. 9 times out of 10, you're going to get an MRI with a contrast. So if we have a shoulder injury and we suspect that the cervical spine's involved, how do we treat that? Well, we treat it many ways, but specifically, we'll take it from a non-surgical point and then we'll go to a surgical point. So from a non-surgical point, you'll come into the office, we look at that shoulder, we examine that shoulder, we find out what the problem is with that shoulder, and then we try to correct that with manipulative therapy of the shoulder. If there's any muscle tightness, we work through that muscle tightness, we give you ranges of motion exercises, and we sometimes will manipulate that area using soft tissue manipulation to help free up the joint, open up the pathway, and allow the joint to move free. Also, we're checking the cervical spine. If the cervical spine has some aberrant motion, what we do there is we'll adjust the cervical spine using soft tissue techniques as well. Sometimes we'll do osseous adjustments. Sometimes we'll use instrumentation to take care of the fixations as well. There's a myriad of ways that we'll do that. Over time, we see how that improves. If it starts improving and you're getting better range of motion following treatments, following doing home exercises, then we're doing fine. But let's say we don't go and get as much information from the exam, from the manipulation, and we find that our treatment has kind of stalled a little bit. The next step we may do is we may talk about doing some physical therapy, strengthening up that area. If I believe that physical therapy is going to be better for you than going right to the orthopedist to look at that, we're going to do that as well. Sometimes we have injections put into that area. We use medication to help facilitate some of the stuff that we're doing. By the time I decide, you know what, this is something that's a surgical intervention, we've had a lot of things done. We've done manipulative therapy, we've done physical therapy, we've done medication, we have our MRIs. So by the time we're done, we know whether or not you're going to be a surgical candidate. That's probably the most important thing that we do in our office. We're trying to figure out, are you a surgical candidate, or can we take care of this more conservatively? And more often than not, we're able to deal with these problems more conservative than people would think. A lot of times you'll go to the surgeon and they'll look at that and they'll go, oh, let's take care of this. All we have to do, we'll set you up for surgery 2 weeks from now. We'll go in there, we'll clean out the area, we'll sew the muscle together and put you through some physical therapy, and you should be right as rain. Sounds great if you really need that surgery. Remember, it's elective. I would try doing non-invasive things before I start doing invasive things. Some of that prior to surgery, you will do some physical therapy. Sometimes you don't. My go-to all the time is let's do something conservative first. Let's do manipulation. Let's work on the muscles and the structures around the joints. Probably do physical therapy, do some medication, and then we'll decide on whether or not we need to see the surgeon. And I will say this, I can confidently say 80% of the time we can make shoulder pain go away completely, or that it is far more manageable than it was when you first came to see us, avoiding surgery. As I say it all the time, I am not against surgery. I'm against doing surgery for the first line of defense. Surgery should be your last ditch effort to repair the area. With all of that being said, if you have a shoulder problem, always get it evaluated by a professional. When I'm saying seeing a professional, what that means is you need to go to your doctor and have them evaluate you and send you to the proper place. Sometimes patients say, I can deal with this on my own without any supervision. What I'm saying is you want professional help so they can guide you through that supervision. When a patient comes to me, they know that at the very least, we're going to do our best to keep them out of surgery, that it will not be our first response. Guys, it's been great talking to you. I love hanging out with you guys. Don't forget, subscribe, like, hit those notification buttons. We're going to have more on the cervical spine related to other symptoms. We may be talking about the elbow and the wrist on our next conversation. Have a great week. We love you. We'll see you soon.